Hey, how you doing? If you're watching this video, then that means either I did an anal fissure or a hemorrhoid or some type of anal procedure on you, or somebody didn't give you instructions. Today we're talking about butt stuff, realistically hemorrhoids and anal fissures. Anal fissure is just a tear from a very tight rectal muscle that we loosen. After that procedure, you shouldn't have a lot of bleeding, you should have a little bit. If you had a hemorrhoid removed, you should have pain that is similar to the worst pain you've had when you had hemorrhoids. There are two types: internal, which is we typically do a stapled hemorrhoidectomy on the inside. You can't feel the staples, so don't worry about that. They usually pass over time. But that one is less painful than an external hemorrhoid. Regardless if we remove an external or do the stapled hemorrhoidectomy for internals, you're still going to have pain that is similar to your worst episode of pain. Now, with an anal fissure, you should not have much discomfort except for on the side of your anus where we put a stitch. These all two come together when you have your first bowel movement. Your first bowel movement is going to be your worst bowel movement. You may have a little bleeding after the procedure. That's okay. If you had hemorrhoids, it can be 2 to 3 weeks before it's completed. If it's an anal fissure, probably 2 to 3 days. The most important thing is that when you have that first bowel movement, we put packing in your rectum that comes out. So it looks like a big clot. It's not a clot. It's a piece of dressing that is used to make sure that you don't bleed after the procedure. After that bowel movement, everything else should slowly return to normal. The only thing I would also watch out for is hard stools. Regardless if it's a fissure or a hemorrhoid, you want to make sure that your stools are soft. I recommend getting Colace. You can get it over the counter. 1 tablet twice a day, once in the morning, once in the evening. If your stools are still hard or like rabbit pellets, you may want to consider adding mineral oil. 1 tablespoon in the morning or 1 tablespoon with each meal, depending how hard your stools are and if you can tolerate it or not. It's pretty nasty, but it does work. If you can get your stools soft for the first 3 to 4 days, it makes a huge difference in your recovery, and continue to have those stools soft like toothpaste until you have no more bleeding. Again, I'll put a thing in the comments that kind of tells you what you want to watch out for. Otherwise, thanks for letting us operate on your hemorrhoids or fixing your anal fissure. I appreciate you rocking with us. Take care.